My name is Jordan Kinnett. I've been a registered nurse since 2009. Been a nurse practitioner for the last year and a half, specializing ironically in infectious disease, specifically HIV. This illness, this COVID-19, kind of started in early March, what I thought was bronchitis, and then kind of within a week progressed into something a little more serious. Thought maybe I had the flu. Flu swab was negative, and then a couple of days later, on some antibiotics for what they thought was pneumonia, I went to the hospital because nothing was improving, and then I was admitted, and then shortly thereafter was admitted to ICU.
We really truly appreciate you being here with us today and sharing your story. And because this virus and the situation that you have gone through is what a lot of people out there are experiencing right now. So we appreciate you sharing your perspective, both as a patient and from your clinical perspective, and what you went through. So had you heard much about COVID-19 or knew much about it before you were diagnosed with it? What kind of led you to believe that maybe you had it, or was it a test, or what did that look like?
Well, basically, working with the infectious disease physician that I work with, we had discussed it. Just didn't really think it would impact our area, as heavily, because I live in, rural part of the United States, and just wasn't expecting we might get a couple patients, but nothing really, severe. And then, like I mentioned earlier, it started off like I thought I had bronchitis. Pollen count is really high right now. I've had bronchitis multiple times. It just had some tightness right here in the center of my chest, a little cough, that lasted for a couple days. And then I started getting a low-grade fever. Still really wasn't super impressed with it because I've had fever with bronchitis. So, but then the last day I went to work, when I left work, my temperature was like 99.6 or something like that, really low grade. It's an hour commute. By the time I got home, it was 102.6. And I was like, okay, so something's going on. And then I stayed home. I thought maybe I had the flu, but I figured, okay, well, I'm past the 48-hour window for Tamiflu, so I'll just self-medicate. So I was, ibuprofen, acetaminophen for the fever and symptom management. Come Monday, hadn't really got any better, still running high fevers, 102, 103. Went to an urgent care. They did a chest x-ray, said it looked like pneumonia, and put me on some antibiotics. And then after taking 3 doses of those on Wednesday, I took my 3rd dose. And about 4 hours after, I still had a fever. And I was like, okay, this isn't a bacterial pneumonia. Levaquin was what I was on, would have covered it, community-acquired pneumonia. And so I went to the emergency room. And then they did a CT scan, and it showed bilateral pneumonia. And they actually treated me for community-acquired pneumonia in the hospital. I got 5 days of IV antibiotics. Not that they did anything, because we found out 6.5 days later, my results finally came back. They swabbed me in the emergency room, but it took 6.5 days to get results. So that's when we found out it was COVID-19.
Basically, from the time the first symptoms started to the time you were positively tested was about 6 days?
Well, as far as the high fever went, but I contribute the bronchitis-like illness as early COVID-19. So that was about March 2nd when that started. And on the 11th, I was admitted.
Right. Now, once you were admitted, and I believe in your story, you talk about the second day, things started getting worse. Can you kind of describe what happened after you were admitted, and what it looked like once the symptoms and the progression of the virus worsened for you?
Well, when I went to the ER, they did me kind of like a sepsis workup, got some IV fluids. That's when they started the antibiotics, did blood cultures, all those types of things. And at the time, the hospital I went to, we were kind of localizing which departments the rule outs went to. And there wasn't a bed available. So I actually spent the night in the ER, but they brought me an incentive spirometer. So prior to all of this, I could easily hit, 4,000, 4,500 on the incentive spirometer. When they brought it to me, I was hitting 500. And as a nurse, I had worked with cardiovascular and cardiothoracic patients. And so I had always seen my patients hitting 500 after surgery. And, I knew how difficult it was for them, but I had never felt that because, I was able to hit 3,500, 4,000, no problem. So that really let me know, okay, this is bad. I can't breathe. I can only take in, little baby breaths. If I tried to force myself to breathe more, it hurt, and it
Sure.
actually made me cough. And I know that's kind of what we tell patients with intensive spirometry. If it makes you cough, you're doing it right. It's
Right.
clearing out those lungs, all those things.
Filling the air sacs. Yep.
But it actually kind of made me decline. I lost all my pulmonary reserve.
Mhm.
But I kind of didn't do the IS very heavy at the beginning. I finally got to a floor 24 hours after the ER. Spent the night. They put me on like 1 liter supplemental oxygen just because I was satting like 93%.
Sure.
And that bumped me up to like 95, 96. Well, then the following day, and that would have been on that Friday, which would have been the 13th, Friday the 13th. They put me, I wound up going up to 2 liters and then 3, 4, then 5. And when I was on 5 liters, I was satting 88%.
Wow.
And that's when they mentioned, and as a clinician, I was like, okay, this isn't good. I'm on 5
Right.
liters. I'm almost maxed out on the nasal cannula. And I'm setting 88%, and I can't complete a sentence. I had to stop to catch my breath. It was pretty scary. And so they mentioned ICU, and in my mind, I'm like, okay, I'm about to get intubated, and
Right.
I've worked with Vapotherm, but I was like, okay, is this going to be the next step, or are they going to go ahead and intubate me as a precaution? So they decided to go ahead and on the floor, put me on Vapotherm, and they actually exceeded the floor limits because the cutoff for the floor, I think they do like 35% or something.
Sure.
And they started me out at 60%
Okay.
at 40 liters a minute. But instantly, like my shortness of breath didn't improve. However, my oxygenation instantly improved,
Right.
Which was a great sign.
Mhm.
And then it was a couple hours to clean the ICU bed because they've been really doing a great job of, they do the ultraviolet lights and bleach and all that stuff, like a 4-hour turnaround on cleaning a room.
Sure.
And I finally get to the ICU and was doing fairly okay until the next day. I had this really bad coughing spell, coughed up some really thick mucus, and it knocked every bit of my reserve out.
Wow.
Once again, I can't take a deep breath. Thankfully the Vapotherm's enough force that I can take a short breath, but I'm still getting good oxygen, but it wasn't enough. I mean, I remember looking at the monitor, my heart rate was like 160. I broke out in a sweat. I'm like, I can't breathe. My nurse was in another room because the ICU was full of patients just like me, but some were on the ventilator. I have no idea what kind of patient he had, if they were on the vent or Vapotherm or whatever, but he was in another room. All the nurses were. And I just remember thinking, this is how this ends. Like I'm about to die because I cannot breathe. I'd hit my call light, no one was there. Fortunately, he came out of the room and he saw me and he came and he put me on 100%. And it still took me probably a good 30 minutes to an hour to get back to where I felt like I could breathe.
Sure.
I mean, I thought I was about to be intubated. I mean, that was.
Yeah. And I know this, the question, I guess, you kind of described a little bit what was going through your mind. I mean, at that particular point in time, COVID-19 was still somewhat, we're still learning things about it now. And at that point in time, I remember reading your story, and it was really one of the first ones I had read, in such detail and everything that you'd went through. It obviously would be very emotional to anybody, but just from your perspective, I mean, had you treated anybody with COVID-19 in your own practice prior? I mean, what was kind of the mindset of everybody around you around this virus and utilizing Vapotherm in that sequence? Was that something that had been done already before? Was there just a confidence in the technology in terms of what it was going to do? How did that come about, and kind of what were your thoughts around that based on your personal experience?
Well, and at the time I was admitted to kind of give an idea of, because things have gotten much worse at my local hospital. I mean, they have just been inundated with, hundreds of people that are rule outs or positive patients. They've had to open up 2 extra ICUs, including the recovery room has been converted into an ICU. They've opened, it's just been, wild. But at the beginning, they only had 1 ICU for COVID patients and 1 small floor. So they were probably, that ICU holds 12 patients, and then the floor maybe held 18.
Okay.
So you think, that's about 30 patients that were ruling out. So it was still very early for this hospital. They had only had, like couple weeks before, they had 1 patient they transferred out that they found out later was positive.
Mhm.
But they don't really know like all the details of how it's spread or everything. But the doctors were kind of up in the air about using Vapotherm because of fear of aerosolization, of
Okay.
the virus and things like that. However,
Certainly.
we knew that if we were inundated, there's not enough ventilators to go around. So you have to save those for the people who absolutely need them. And knowing that Vapotherm is a great non-invasive, mode of oxygenation, that's what they went with. So, because I
Excellent.
was concerned maybe ventilation, going on the vent.
Sure.
Um, I'm glad that Vapotherm was an option because, I know, a Veni mask, I wouldn't have had enough. It's not enough force,
Mm-hmm.
to get the air in. Non-rebreather wouldn't
Certainly.
have been an answer either. So, if Vapotherm didn't happen, or if there was no high flow nasal cannula anywhere, like I would have been on the ventilator like that. That's no question.
Certainly. Now, prior to this, had you used Vapotherm at all in your practice, or
Not
had
in
any experience to it?
not in my practice, but as a nurse, like as a provider, I haven't used it, but as a nurse, I've used it countless times.
Okay.
On step down as well as when I've done med surge.
Okay. So as you're on the technology, just from your perspective, when you were on the technology and exhibiting these symptoms, how did it help you? How did you feel like it helped you? Obviously, you talked about your work of breathing still increased and you were still struggling. And obviously part of that is mental, right? You're scared, you're breathing hard, you're trying to get that breath. Aside from the saturation, was there anything else that you feel like from the patient perspective, I'm always interested in knowing what that felt like and did it help relieve any of the dyspnea or work of breathing that you experienced?
Well, the work of breathing, I really feel was just, one thing that that I've, read recently and all of that is that you lose pretty much all elasticity in your
Yep.
lungs with this because of
Mhm.
the interstitial edema, almost kind of like a fibrosis or other restrictive lung disease.
Right.
And so really and truthfully, the work of breathing was still hard. Even after I got home, that was hard. But it was more like comforting in the fact that because
Hmm.
I knew that there was so much oxygen coming in that I didn't have to take a deep breath. I didn't have to feel like I had to take this, giant deep breath to get enough oxygen because I couldn't physically. But it was comforting to know that there was enough oxygen going in my nose that as I could take, and this is how the breaths went.
Okay.
They were literally that shallow. It was, I could not take a deep breath, but knowing that there was enough oxygen there, like I kept looking at the monitor, looking at my sats to see how they were doing. And I pretty much stayed above 93% unless I moved around. If I
Okay.
tried to get out of the bed to do anything, my sats plummeted to the
Wow.
80s. And I had to go back on 100% for a couple of hours. But I was able to stay at about 60% most of the time until they started, until they started weaning me.
Okay. I think that's interesting because what I'm hearing from a lot of practitioners and respiratory therapists that I'm working with is they're, in the same situation you're in, they don't want them getting out of bed too far away because their sats drop immediately.
Well, it was kind
And
of my fault because
uh-huh.
I was like, I need to move, because I was like, I've already been in the hospital 2 days. Every day you're in the hospital, not moving. It takes 2 days to get back your strength. Like it
Right.
was the clinician side of me
You
was
know
like, I
too
need to get
much.
up. Exactly.
Right.
And I did too much too soon. And that was just kind of pivoting to a bedside commode. I wasn't like walking around.
Yeah.
It was literally just standing up, pivoting, sitting for a little bit, and then pivoting back into the bed. And it was too much.
Right. So as the progression worsened, obviously it sounded like you got up to 40 liters a minute, 100% oxygen. And so how long was it between the time that Vapotherm was implemented until you started feeling better or they started weaning the flow in FiO2? What maybe days or hours did they start, did you start on that downhill recovery phase in your mind?
I think it was about the second day in the unit. They started the Vapotherm on Friday, and I believe Sunday they
Okay.
dropped me to 50%.
Okay.
And I think that's when they started. And then, yeah, it was Sunday because I was a bad patient because Saturday night was when I got up to the bedside commode, lost my breath, put me on the 100% for a couple hours.
Mm-hmm.
Well, then the therapist was like, okay, well, we'll kind of let you recover and then we'll come back and we'll wean you down.
Right.
Well, anyway, well, she didn't come back and I was just like, okay, maybe she's busy. Well, me being too knowledgeable, I started weaning myself back down to 60%. I actually reached over and dialed it down to like 90%. Then I went to like 80, 75, 70, 60. And I kept it on 60 until the morning. She came in, she wasn't too happy that I was messing with her vapotherm because apparently the provider was like, keep him on 100%. We'll do a blood gas in the morning, see where he is.
Right.
Oops. Which also, I mean, I kept looking at my sats and I was like, okay, I'm normally around 95% on 60, 60% FiO2. And I was like 98, 99. I was like, I don't need to stay on 100% any longer. Like we can start weaning me down, like I don't need 100%. So that's why I weaned myself down. So in the morning, I was 96% on 60% FiO2. So anyway, she was going to crank me back to 100% for an hour, then do the blood gas. She was like, we'll just do the blood gas now. Well, it was perfect. So then I looked at her and I was like, well, I guess it's a good thing I was a bad patient because.
Yeah. So obviously we don't recommend that if you're the nurse, right? You don't want people changing
right.
and stuff, right?
Right, exactly. Don't do it.
Well, I've yet to find a good clinician, respiratory therapist, nurse, doctor, anybody that make good patients. So I'm sure you're in good company as far as that's concerned. So can you describe some of the other things that started getting better, from that Friday to Sunday when you started weaning down? What was your overall condition? How is that improving? You mentioned incentive spirometry. You obviously you were aware of your work of breathing and all of that. What did that look like? How was that? What did you notice improving first? Obviously you're running fevers. Some of that would have been controlled through medication and other things, but kind of describe what it looked like from that Friday on and what the recovery looked like for you in terms of improvements.
Well, the ability to take a deep breath really didn't. I think when I got discharged, which would have been several days, I was in the hospital for 8 days and then on the 11th, discharged on the 19th. I think the last day I was probably only hitting 1,500, 2,000, maybe 2,500 on the IS, which still wasn't great. It was a great improvement from 500, but I knew I could, still go further. But kind of with the IS, it kind of just slowly started to increase. Maybe on Sunday, I might've been able to hit 750, maybe,
Okay.
I mean, it just, I know nebulizer treatments, they had tried those in the beginning. Didn't do anything.
Didn't work.
Duoneb, straight albuterol, nothing. I mean, it just did not work. It didn't open up anything. I couldn't get any mucus up, except for that one time, on that day that they had put me back to 100%. But the work of breathing stayed pretty much the same. I still couldn't take those deep breaths, but I was slowly able to take deeper breaths, but it still was very shallow.
Now, very
quick.
Did they happen to do a CT scan to determine, was that the conclusion? Did they do a CT scan on top of your swab to determine positive COVID?
They did the CT. Well, so they did an X-ray okay, let me rewind. All right. So I went to urgent care on that Monday, which would have been like the 9th. They did an X-ray. She said it looked like pneumonia. That's when I got on antibiotics. Well, then in the ER, 2 days later, they did an X-ray and she's like, I don't really see a pneumonia, so she was actually thinking maybe a PE or something because of the shortness of breath. I was a little tachycardic, they can cause fever, things like that. So that's why they did the CT scan, CT with contrast to rule out a PE. And that's when they found the multifocal bilateral pneumonia.
Wow.
So that's when she was like, okay, you've got a pneumonia, we'll get you admitted. But let's do the swab just in case. Okay. They did a repeat flu swab, and then they also did the COVID-19 swab.
Okay. Wow. So as you're improving over the weekend and your work of breathing's improving slightly, your incentive spirometry or the spirometry that you were doing was improving somewhat. What was the discussion like around the discharge? I mean, obviously, this is, from what I understand, and correct me if I'm wrong, this is like the flu times 10 when you get it. I mean, it hits you hard, it hits you fast. And then based on what we're seeing and hearing about the recovery phase of this, it can be quite lengthy. So can you describe a little bit and tell us what it was like during those final days of being in the hospital and what the discussion sounded like around the discharge. Because obviously, I mean, if it were me, I'm just thinking from my perspective, I've just overcome an episode of this virus. It's fairly new. It happened quick. And now I'm on this phase of recovery. What did that discussion sound like about discharge and what the next steps were?
They kept weaning me down, finally got me down back to nasal cannula. I think they put me on 4 liters at first. And then within like a day, I was on 2 liters. And there was discussion about possibly sending me home with oxygen. And that was kind of me pushing it, because I was like, look, I worked in the hospital. You can get, the longer you're there, the chances of getting sicker. Like, I don't need a staph pneumonia. Like, I don't need any other stuff happening. So like,
right.
If I have to go home on oxygen, I'll do it. Like, just let me go home, And so that was kind of the thing. But then they did the 6-minute walk. And I was able to maintain my sats on room air, at 93%. Still not fantastic, but much better than it was.
Sure.
My heart rate got up pretty high. I mean, it was like 130, just walking around the floor. And that was kind of like a slow pace. But I was able to go home without oxygen, thankfully.
That's good.
And I'm probably the only patient on the planet that continued to work with the IS after I was discharged.
Mm-hmm. Yeah.
So I continued to do it and continued to see improvement there. And now I've maxed it out. It goes up to 5,000. So I can finally max it out.
So how many days, just because that is to me a tangible marker, from the day you were discharged to now hitting your peak or your optimal number on the spirometer, how many days was that before it got
about 2 weeks? It was about 14 days before I could finally get up to, because I was able to hit, like I got up to 3,000, 3,500. A couple of days later, it was 4,000, 4,500. And I hit 5,000 like one time, but then I had a pretty bad coughing spell. And I was like, okay,
wow.
I don't want to push myself too much. And then, because I got really short of breath after. And then it was a couple of days after that. So probably about 2 weeks though, really, before I could finally, get it all the way up there.
Wow. You mentioned the cough a few times in our discussion here, and that seems to be one of the big, when we talk about how to identify or be aware or a symptom that's common with COVID-19, you talked about the cough. What did that cough feel like, just for people out there? I mean, was it a deep bronchial cough like bronchitis? Was it productive? Was it just something like an irritated airway?
In the beginning, it was like a bronchitis. I mean, it was a pretty deep, but it was a hacking but non-productive cough. Mm-hmm. I've only been able to produce mucus just a handful of times since March 2nd. I mean, okay. So this has now been over a month. Still have a slight cough. It's not as bad, because last week, we were trying to set up an interview time. Right. If I spoke for extended time, like I would have a coughing spell. And I was like, okay, I can't, it's too early. I can't do it just yet. So that was kind of one of the things about setting this up was, can I have a conversation without coughing? And so more recently, the cough is just now like just an annoying irritation, and I'm pretty sure it's probably, not to get to like anatomy, it's probably the cilia now regrowing and repairing themselves because they were damaged. And so it's probably something along those lines with physiology. And now they're trying to clean out some junk, but it's just an irritation really. And so it's different than it was in the beginning. Like I said, in the beginning, it was a bronchitis type cough. And now it's just like a tickle and kind of like in the back of my throat kind of thing. And I cough a little bit and then it kind of goes away for a while.
Right. So I know that you're going to be potentially returning to work within a few days or within the week. How's this experience going to change or affect how you treat either potential COVID or confirmed COVID-19 patients?
Well, with my clinic, we won't really be treating any COVID-19 patients directly. I mean, because we do more outpatient management. But just in, especially since I do specialize in HIV, there's illnesses that can happen that causes severe shortness of breath, like pneumocystis. And it kind of, not that I wasn't compassionate or sympathetic to it, but now I can actually have more empathy for those patients who just are so short of breath. Because I know what it now feels like to not be able to catch your breath, to
Sure.
not be able to breathe. I mean, it's a very scary feeling. And so now I feel like I can relate more to patients with any type of shortness of breath, like that, any respiratory distress.
Exactly. So I guess in terms of, knowing a little bit more about what we know now about how this disease, or this virus rather, is transmission through either touch or, exposure to somebody else that has it. Do you recall how you might have been exposed to this at all, or, have any idea?
No clue. The kind of the theory was that there was, an individual who came down who later was positive, but had performed 2 funerals in the area. And, it was a minister. So I'm, kind of thinking like for the funeral, several people going up, shaking hands with the minister, hugging the minister, whatever. So that all that transmission, and then these people went back to work, worked whatever they did. And so, I mean, like it could literally be anything. Like, I mean, I could have walked through someone's cough cloud, or, someone could have touched something in a grocery store that I picked up, or at a drive-through. I mean, there's no telling. I mean, it's just, there's this, I mean, because it was all around the same time was when the hospital got inundated. So it had to have been shortly after those 2 funerals that's what they're thinking maybe the kind of the culprit is, these people are coming from these funerals and now they've spread it to the community, and now everybody's getting it around the same time.
Exactly.
Several people have asked me, have I gotten it at work? No. I mean, I haven't had any patients with any symptoms, and my patients would show symptoms. I serve an immunocompromised patient population, and so they would have shown symptoms, and I feel like I would have known if there had been something going on with them.
Sure.
So I really just feel like it was in the public.
Yeah. And I think that's the other thing is, we hear so much about the pre-existing condition or a comorbidity that may make you susceptible to this virus at its worst. Not asking to go into great detail, but, in reviewing your clinical history, your health history, did you have any comorbidities that would make you susceptible to this?
I mean, I've got reflux, but that's managed with medication, and that's really it. I mean, I'm a little overweight, but as far as like heart disease, lung disease, none of that. I'm not diabetic. I mean, like that. I mean, I'm literally, other than the reflux, but like I said, that's managed with medication. I don't have any other medical diagnoses.
Sure. So, based on your experience, and back in December and January, COVID-19 was something that you might have seen on the news randomly. It was a virus that was being dealt with on the other side of the world. And just like you in my small community, it's now here, right? And so with what you've gone through and your own personal experience, and obviously we didn't even touch on the impact of your family, right? And the impact of the people around you. What advice would you give to people out there? And I read your story online, and it, struck a chord with me. And I know one of the things that you'd mentioned is you wanted to share your story and get it out there because, there was very little being heard from the trenches at that point. What advice or what would you like to say to people out there watching, either from a clinical point of view or from a patient point of view, your experience and kind of what your thought on it is now?
I'll probably start as speaking to the clinicians out there. One thing is I cannot thank them enough for everything that they did, because we know the shortages of personal protective equipment out there. For instance, the local hospital here, they purchased like 6 months of equipment and they went through it in a week. They thought they were trying to be ahead of the game because they were expecting 1 or 2 patients, not, to all of a sudden have 30. And then that 30 became several, because when I was discharged from the hospital, they had then opened up other units. Like they had converted med-surg units. The entire floor was now COVID-19 patients, and they had then stretched it to that point, I think, to another ICU. And then just a couple days after discharge, all 3 ICUs were now COVID patients, and then had to open more and all that. But like I said, to the clinicians, thank you, because it's not easy. As a patient, it was difficult because I couldn't have any visitors. And so I can imagine all the nurses and respiratory therapists and physicians and everybody who came into contact with me, having to go home, can be concerned, are they going to spread this to their family? So I mean, there's too many unsung heroes, with that. I mean, because people don't realize, so a lot of times people don't realize what clinicians do in the hospital, period, let alone, what they have to put up with at home. In this case, the concern of spreading it to their family, because we face a lot of things on the front lines, and we're also worried, like, am I going to take this home? And so one of my nurses, for instance, said she hadn't really seen her family except through a window for days. That she would come home, basically strip in the garage, scrubs and everything, went straight to the laundry room. She went and showered, but she quarantined herself across the house, away from her husband and her kids, because she was too concerned about spreading it.
Sure.
And I just couldn't imagine what that felt like. I mean, I know as a patient, not allowed to have any visitors, that was rough. And then, I mean, like, I was able to FaceTime and all that. That's still not, really the same, and then I feel like the people who have underlying health conditions are probably taking this more serious than those who do not. I've seen several posts on Facebook from people younger than myself, oh, I'm fine. I'm 20 something years old. I don't have to worry about it. Okay, well, one thing is, yeah, you might not. However, you've got parents and grandparents more than likely. So how are you going to feel if you go home or go visit, and then 2 weeks later, your grandmother's on a ventilator?
Right.
So those type things. So no one is immune from this. I'm 31, fairly good condition. Like I said, I've got reflux, but I don't really consider that really that big of a deal. But I went up in the ICU, so, I mean, there's people who are in their 50s who just have a cough, don't ever go to the hospital, but I'm 31 and wound up in the ICU, and in my post, I had made the comment about, I wasn't supposed to get this. And it wasn't like this statement of, oh, I'm immune, like I can never get this. It was a statement of, like, based on what everyone was saying, based on the media, based on all that, like, a 31-year-old healthy male shouldn't get sick from this,
Right.
So the whole purpose of my post was to get it out there, like, look, you can get sick from this, and this can take you out of here. Because I know that if I had not gone to the hospital, I would have died on Friday the 13th. Because when I was on 5 liters at 88%, and satting 88%, I would have respiratory arrested at home.
Right.
Like, and there was nobody at home. My spouse was at work, and I would have been found dead in bed when they got home.
Right.
So to anybody out there, like, this is real. Please take it seriously. Stay home. If you have to go to the grocery store, send one person. Don't make it a family venture. I mean, that's really the best advice I've got, is just take it seriously.
And I think that's, a very powerful statement, Jordan. And I think, the optimistic point of view is that it does have 80% will either show minimum to very mild symptoms, or the recovery there for those is very high. But you bring up a very valid point that I think a lot of people overlook, is that even if you're not symptomatic or you are exhibiting the extreme symptoms of this virus, you still pose and I don't want to use the word threat, but you pose a risk to those around you that may be susceptible to this. And I think that, along with the fact that there is such a long window of when you can show the symptoms, right? Or the virus shedding can be 6 days to 14 days. And by that time, you may have been in contact with, to your point, I don't know where I contracted it. If you go backwards from the days of when I started showing symptomology, I was everywhere, and you could have been exposed to it in many different ways. So I think your message there is a strong one, and definitely one that people should listen to, whether you're a clinician or a layperson that's just trying to learn more about this and understand it.
And let me add another thing too. At 31, like I never thought that I would have to have end of life discussions with my family. What expectations, how long if I go on a ventilator, how long, and this all happened via text message. This is something that I wasn't prepared for, but it was like, okay, I want to be intubated. How long, if I'm brain dead, those type of things, like when to take me off of, I hate to use the word life support, but you know what I mean, when to
Right.
come off a ventilator, when do I come off of life sustaining measures? And that was a conversation I had via text message,
Right.
at 31 years old in a hospital with nobody. I mean, you're by yourself, you can't have visitors. Yes. Your nurse, the clinicians are having to bundle care because they're to try to conserve PPE, to try to keep from burning it through it. They're trying to bundle everything in one visit for several hours before they come back.
Right.
And so, like I said, I mean, nobody's immune, but just imagine having to have that conversation, as a young person about what your expectations are in the event something traumatic happened and I had to go on a ventilator.
Right. Well, Jordan, I think when I read your story online and on social media, and I actually had your story sent to me by probably around 3 or 4 people. And it's funny how social media connects everybody, right? It really makes the world a very small place, because I saw your story popping up in other parts of the country, and I'm sure parts of the world that I wasn't, be able to be seen. But I think, social media can be it can bring out the best in people, and it can bring out the worst in people. And what I saw through your story, for me personally, reading it, and then I was like everybody else. I'm not, there's a lot of things out there that get typed up and things like that. And then as I started looking into it and investigating a little bit more, I reached out to some people that literally knew you and knew you had wrote this story and wrote this first person perspective. And, I reached out. I'm like, can you get me in touch with this guy? Because I want to talk to him. I really want to hear his story. And so for me, this is, it's just a real pleasure to get to talk to you live, get to talk to you face to face, even though it's through computer, and really hear firsthand account of this story, and know that, for one, the outcome was positive. So we're very thankful for that, for you and your family. And secondly, we're so thankful that you've been able to spend time with us and share your perspective on your experience. And I hope that other people that view this, whether you're a clinician or a layperson, again, like I mentioned before, gleans a little bit of perspective out of this, learn a little something, because I think it's something we can all take away and benefit from. Is there any last words? I know we covered a lot. Is there anything that you want, just to say, any last words on any of your experiences and how this has changed you?
Well, for one thing, definitely appreciate every day you have, because you never know when it'll be your last. I know that sounds kind of cliche, but I mean, in a matter of 9 days, I went from being able to, I went to work and was fine, and then I'm in the hospital, and 2 days later I'm in an intensive care unit, and not knowing, was I going to make a turn and recover, or was I going to decline? Because that's one thing we've kind of found out, that when these COVID patients start to decline, it's very rapid.
Yes.
It's kind of like you kind of sit there, and then all of a sudden respiratory, status declines rapidly.
Mm-hmm.
And so and we didn't know that at the time I was in the hospital, but it was, I noticed that I was declining rapidly. I could tell, being a clinician myself, knowing, okay, well, this is where we're going, this is what's next, and all right, I'm on Vapotherm now. This is the last step before intubation, like if I can't oxygenate on this, like
Right.
we're going to have to, and so that may have probably been, being a clinician probably was my worst enemy to this, because I knew too much. I feel like a layperson probably would have been like, okay, you're going to go on vapotherm, and they'd have been like, okay, well, what's that? Oh, it's going to give you, lots of oxygen through your nose so you can breathe better, blah, blah, blah. Okay, cool. But in my mind, I knew where these steps were going,
Right.
And so, and then another piece too is that, you said that social media brings out sometimes the worst in people. And there was people who were pretty nasty on there. But one thing I want to kind of talk about as far as my post goes is several people just didn't believe it because they thought, well, how did someone, if you're in the middle of this, how did you write it down? Well, I didn't. One, I've got a pretty good memory. Two, I'm a nurse, so it's been my job to document, and a lot of times, like for instance, and I'm sure you've been in a code situation before, and you might not remember exactly like what time something happened, but what you did. What happened to you, right? And so that was kind of the same thing for me. And then the third piece of that too is when something traumatic happens, you remember a lot.
Sure.
And then especially, for instance, if someone were to ask you where you were on September 11th, 2001, most people remember exactly where they were, what they were doing, and all those details. However, if I asked you what you ate for breakfast on February the 4th, 2008, you'd be like, I don't know.
Right.
And so it's the same thing. This was a very traumatic experience for me. And no, I didn't take notes along the journey. I didn't. But the last day I was in the hospital, or maybe the second to the last day, I don't remember which day it was. If it was the, 18th or 19th when I shared it, I don't remember, but maybe it was the 19th. I think I was getting ready to do my 6-minute walk or whatever, but that's when I typed it up because, several friends were like, share your story because so many people out there aren't taking this seriously. People think that they can't get this or that it's not going to affect their part of the world. Here I am. I live in a very rural area, and it has completely overwhelmed our hospital, and so I couldn't imagine if the same magnitude hit larger cities elsewhere, I mean, it has just been completely mind boggling to me how it's all went down, like I said, when we had the Ebola crisis several years ago, we had an Ebola room at the hospital. We were prepared, but didn't really think we'd ever get a patient, and with this, it was like, we didn't really know how was it transmitted? And there was too many questions because it was so new. But I don't know. I mean, it's just been, and then we're still learning new stuff every day. Now we're learning how it attacks hemoglobin, in the blood. And so there's that component of your oxygen carrying capacity now is affected, not just your breathing, I mean, it's just so much that's coming out every day.
Right.
But I just want people to take this seriously, and stay safe.
Definitely. Any advice for family members?
I do, and this might not be for everybody, but for me, it kind of got to a point where I appreciated people checking on me, but it was so many people. Like I was constantly getting texts or Facebook messages or whatever, and it kind of got overwhelming. It was very much appreciated, but it was like I kind of wish like one person from this family would let my family be the ones to disseminate the information or whatever, just because it was just very overwhelming. Like I said, much appreciated because I needed it, but at the same time, I mean, people were calling. I can't breathe. I can't talk to you. If you text me, I'll try to respond when I can. My sleep schedule got messed up. Like I'm still trying to fix that. Like I didn't go to bed till 4:00 this morning. I woke up at noon. Like, I got to be at work at 8:00 Thursday morning. So we got 2 days to figure this thing out, but just the fact of, trying to, FaceTime and all that, don't overwhelm someone who's in the hospital, especially if they're in the ICU, like if they're on the floor, chances are they're doing pretty good. They might can talk, things like that. It all depends on what's going on with them. I just know I couldn't talk. I mean, I couldn't complete a sentence without having to stop several times to catch my breath.
Sure.
But then as far as like the quarantine stuff, I mean, even when I came home, I mean, we still quarantined, for 2 weeks. I mean, it was literally, like I was in, the master bedroom and had the master bath. And then on the other side of the house, we literally we isolated from each other. Go ahead.
So what would be, I guess that's the next step is once you're home and you're in quarantine, what was the conclusive clean bill of health from this? Was it a couple backup tests? What's been the measure of success in terms of you're good to go now?
Well, they're basically kind of basing it on symptoms. When I got discharged from the hospital, they said I needed 2 negative tests 24 hours apart. Well, then they quit doing that.
Okay.
Like the day I went home, I think, or the next week or something, because when I called to try to see if I could schedule an appointment or to see how this process was going to work, they were like, well, we're not doing that. And I was like, okay. Well, I told my work, my employer that I'm supposed to have 2 negative tests, and now you're telling me I'm not. Like, that's what they're expecting anyway.
Sure.
So I kind of went the back route, like in the local health department was doing tests for healthcare workers. And I was like, well, I'm a healthcare worker.
Okay.
So I went and did a test. And unfortunately, it took a week to come back, but unfortunately it was still positive, and that was 2 weeks ago.
Nice.
Or a week and a half ago. I don't know. I've lost track with the dates. I mean, like I haven't been to work since March 6th, so I don't know what day it is. I know it's Tuesday because that's when we scheduled the interview. But
good.
As far as the date on the test, like it's been a week and a half, and it'll be 2 weeks. Okay. So it was still positive. So I don't know. I mean, I don't know. No one's really talking about doing a repeat test. We'll be wearing masks at work. We've been told that. I mean, and when we come in contact with patients, I think they're going to have us within 95. So, I mean, my patients will be protected. I'm not going to be able to breathe, but
yeah,
but I mean, we're just kind of going on symptoms. And last week when my doctor called me, I was still having, I mean, if I got up to go to the restroom, just to go to the restroom, and we're talking maybe that's 15, 20 feet from, my bed, my heart rate would get up to 150 just walking to the bathroom. But within a couple days that went down to like 120. And so I'm still a little tachycardic, not too bad, not really a short of breath. Like I can actually stand up and cook a meal now without having to stop and take a break. And so within the last week, like it's really, well, since last Wednesday, like I've really seen kind of more dramatic improvement kind of in my symptoms.
Good.
And the last couple of days, the cough has just gotten much better. I'll have an intermittent cough here and there, but it's been nothing like it was.
Perfect. Well, Jordan, I really, on behalf of myself and our entire team, we really, really appreciate you sharing your story and spending time with us today. And as I mentioned before, it's so nice to be able to put a face with a name, a face with a story that has a great outcome, right?
Yes.
And, as you mentioned, we want to thank all the healthcare workers out there. And that includes everybody that works in the hospital. Keep the lights on, to keep everything moving, create a very safe and clean environment for all of our healthcare workers and the patients and their families. We really do appreciate everything they're doing out there. And Jordan, thank you so much again for sharing your story. We all send our best wishes to you and your family as you continue to recover from this. And please keep us posted on how you're doing. We'd love to hear from you. And we'll sign off and have a great week. And we're excited for you to get back to work.
And one more thing too is to thank you guys at Vapotherm. Because this technology is literally what kept me off the ventilator. And so thank you guys for the technology, because if it wasn't for that, like, I don't know where I'd be right now, because we know that sometimes when people get put on the ventilator, they don't do so well with this. And so I don't know where I would be if it wasn't for Vapotherm. So I appreciate you guys.
Well, Jordan, that really means a lot. We have a lot of people that aren't able to get to the bedside. And for over the 35 respiratory therapists and nurses that we have working in our field and our clinical team and our field team, these stories make it so worthwhile to hear, because we miss that patient interaction like we used to get. And so this really means a lot to us, and it means a lot to me personally. So thank you for that. And we do really appreciate it. So thank you so very much.
It's my pleasure.